My name is Adi Macia and I am going to talk about the reason for low fidelity to educational programs in patients with gestational diabetes. Definition: gestational diabetes is defined as any degree of glucose intolerance with onset or first recognition during pregnancy. The definition applies whether insulin or only diet modification is used for treatment and whether the condition persists altered after pregnancy.
Let's start with some background. Gestational diabetes is a temporary type of diabetes and is one of the most common health problems for pregnant women. Glucose intolerance is an early stage of the condition.
Gestational diabetes is not your fault. It's caused by the way the hormones in pregnancy affect you. It occurs in about 5 to 7% of all pregnancies, so you're not alone.
During pregnancy, an organ called the placenta develops in the uterus. The placenta connects the mother and baby and makes sure the baby has enough food and water. The placenta also makes several hormones. Some of these hormones make it hard for insulin to do its job controlling blood sugar, also known as blood glucose. Insulin opens your cells so that glucose can get in. During your pregnancy, your body has to make about 3 times its normal amount of insulin. Gestational diabetes develops when the organ that makes insulin, the pancreas, can't make enough insulin for pregnancy. Without enough insulin, your blood sugar can't leave the blood and be changed to energy. This causes extra sugar to build up in the
Application in nutrition. Medical nutrition therapy is a self-management therapy. Education, support, and follow-up are required to assist the human to make lifestyle changes essential to successful nutrition therapy.
The best way to control gestational diabetes is through diet and exercise. Try to eat meals that has a low glycemic load. For example, pair whole grains and vegetables with some lean protein and good fats. And try to avoid processed and sugary food as much as you can. They can spike your insulin level and create blood sugar level fluctuation. Cinnamon is a great spice to use to control blood sugar level. It also has a naturally sweet taste that can help satisfy a sweet tooth without any added sugar.
Issue apply in Ecuador, when the incidence of this disease is 7% and currently in Ecuador 142 to 1,084 cases occur per 100,000 inhabitants. Pros and cons. Pros: excellent glucose control is as foundational as appropriate weight gain and adequate nutrient intake. By adhering to this diet and by promoting self-care with self-monitoring, and pregnant women with gestational diabetes can gain control over high blood sugar levels and avoid serious complications. Cons: hormonal changes that occur during pregnancy responsible for mood disorders and anxiety, also create insulin resistance and can lead to gestational diabetes. Conclusion: the first step in treating gestational diabetes is modified your diet to help keep your blood sugar in the normal range whilst continuing to eat a healthy diet. Thank you.
I'm Lindsay and I gave birth to my little girl yesterday. I was diagnosed with gestational diabetes at about 36 weeks pregnant, so I had to have a blood test to confirm that and take my blood sugars before and after each meal. After that, I had to change like my diet and my lifestyle because it does affect the baby. I had a growth scan and the baby's growth had kind of shot up. So that's why they tested me for it. It was a bit of a shock because obviously it was the very end of my pregnancy and then I had to do these like lifestyle changes. But if you exercise a little bit and change your diet, then you can control it yourself. I was put on medication for the remainder of my pregnancy, but again, that was under control. They keep a good monitoring on you, and I was induced at 39 weeks. And she's here safe and sound. You can still breastfeed if you like. And I've got to have an annual blood sugar test at my GP, and there is risks of type 2 diabetes in later life, but as long as you just keep doing what you were doing, then you should be okay. So it is a positive experience if you can make it one, and the staff have been really good. So 6 weeks after the baby's born, I have another blood sugar test which will tell me if it's completely gone, because once you've delivered your baby, it's the placenta, and that's where the disease sort of comes from. So once that's gone, then it should disappear. Okay. So once baby's born, the next day you have a fasting blood sugar in the morning, and that was fine for me, luckily, so that means I was all good to go. And the baby has blood sugar test after their first 2 feeds, which again were good. So although you have to test your blood sugars like before and after each meal, you get used to it, you get quicker at it. It is like easy once you start doing it, and then you get into a routine, just like you're going to get into a routine when you have your baby. So